Hello, everybody. I've got just a few announcements to make, and they're huge announcements. You heard earlier that we had gone from, I think, 20 confirmed to 39. We surely anticipated that this is happening, and it's our great people that have done from our medical community, they're doing a lot of good work and everything. We're trying to stay ahead of the curve and all that kind of stuff in every way. We're very concerned about the nursing homes, as I said earlier. The day of prayer, to me, is really, really significant. Personally, I believe with all my soul that God above is going to get us through this, and we should continue with our day of prayer. But it's just like everything that's happening here. There's things. This is so fluid, and all the different decisions that have to be made, and so there's decisions that are impacting lots and lots and lots of people, and we need to give them answers. And so I have two really, I guess, announcements, and then I'm going to leave you to the medical people, because there's another thing that I'm really involved in right now from the standpoint of getting in touch with the White House, and there's issues as far as additional supplies and stuff like that I'm working on that I've got to go do. And so let me just say this. Today, I have now instructed our tax commissioner, Dale Sager, to extend the West Virginia income tax filing and payment deadline until July 15th, which corresponds with our federal government 2020. We've worked a lot on this. We give Secretary Hardy and all of our tax people a lot of credit. All along, it's not that we've been pushing this or kicking it down the road. All along, we've been working it and trying to find any way and every way that we could fit this together and make it work. I think really and truly with the driver has to be, from our end, two different things. First and foremost, the conveniencing of our people, and that's overwhelmingly that. I mean, from the standpoint, if you're going to do one filing and you're doing your filings with H&R Block or whomever it may be, we surely don't need to task you to go do two different filings. However, with the overlapping of the fiscal year responsibilities and a great shortfall of dollars that could come into this year and how you're going to fund that rainy day or whatever you're going to do, there's been a lot of discussions, needed discussions to go on. Now, the thing that is pushing us all over the hump here and giving us the opportunity and promise to be able to go forward with this is, we do have now a lot more insight into the government stimulus dollars and how they're going to flow, and how we're going to be able to keep government running in West Virginia. So we're extending, or I'm recommending that we're going to extend till July the 15th. And the other thing I'm doing is just this, and this is totally in my power. I have to recommend to our tax commissioner on the other, but I'm also waiving all the interest and the penalties on our property tax filings until May the 1st. And so the way that is set up is, they're due March 1st, you have till April 1st. After April 1st, you've got penalties and interest and all that. Now I'm extending that until May 1st and everything, just to see where where everything will fall out, with our stimulus package, lots and lots of different things and everything. So I'm just checking to see if I've got anything else. The only other thing is the state tax department will be posting all administrative notice and everything on our website tomorrow. So give them until tomorrow and to get everything up, and it'll instruct you properly as far as the property taxes and your income tax filing and everything. Everything will be on our website tomorrow. That's one. The second one is just this. I am very, very hopeful that our kids are going to be able to go back to school at some point in time. We're not there right now by any stretch of the imagination. We need to give our families, proper time to be able to make arrangements in every way. So I am instructing our superintendent today, Clayton Birch, to extend the statewide school closure till April the 20th. And so that's a week, that's a Monday week after Easter. And I think that probably encompasses and takes into consideration all the spring break stuff and all that is out there. And I'm very hopeful that on April the 20th we can go back to school, but we'll have to see, just like everything else we've done. So anyway, with all that being said, now I'm going to leave you. I'm going to leave you to the experts in the medical fields, and I'm going to go to work in another area right now. But anyway, I thank you so much, and keep saying many prayers. Today was a great day, and but we need those prayers for these people in the nursing homes. We need the prayers for our state in every way, shape, form, and fashion. Thank you so much.
All right, ladies and gentlemen, as part of our briefing today, our friends with the media are once again joining us by teleconference. We will be taking their questions in just a moment. But first, we're going to take comments from a few of our panel members. Up first is Dr. Clay Marsh with WVU.
Thank you. Can you guys hear me okay?
We can.
Very good. So as the governor said, we saw a significant rise in the number of cases of coronavirus, the novel coronavirus, and that's relative to the number of people that we've tested. So we went from about 3.3% positive to about 5.1% positive. And this is the start of that kind of logarithmic inflection point, most likely. And this is the time in which we would expect it. So there's nothing that is really surprising from this, but it does really support the steps that we've taken related to the stay-at-home order, the stay, socially distanced 6 feet or more, wash your hands, avoid your face, and try to stay in your house as much as possible. During this time where you start to see this logarithmic phase of the virus growing in our community, it is really a particularly powerful opportunity for our community members to really start to put a halt to the spread of this virus. And as we said before, so the novel coronavirus has an infectivity ratio that is much higher than, say, influenza or the flu. So every person who is infected with influenza will at least predictably infect about 1.2 to 1.6 new people. The novel coronavirus seems to be able to infect more. So the average infectivity, as I understand it, a single person with the novel coronavirus will infect 2.6 to 3.1 people. And if you just kind of look at the power of this infectivity kind of ratio, so let's just say that you have a person and the infectivity ratio is 2. So one person infects 2, 2 people infect 4, 4 people infect 8. Well, it takes 10 times of that cycle going through, 10 doubling times, and you get 1,000 people infected. 20 doubling times, you get 1 million people infected. And 30 doubling times, you get 1 billion people infected. So the compounding effect of a person infecting 2.6 to 3.1 and so on and so forth leads to this exponential rise that we're seeing. So I think that right now, what we want to do is we want to reduce the food that this virus feeds on, which is contact between each other. And this is a really important time for us to really rally around, protect each other, protect your families, protect your communities, and protect the healthcare workers. Because as we know, the surge that can happen from this rapid logarithmic spread is what threatens to overtake the healthcare sector and the healthcare workers. And that's really part of what we're trying to do to reduce this wave. I will say 2 or 3 other things, and I'll stop my comments and I'll pass it on to others. So we're finding in the United States, this virus is infecting people that are younger than we found in China or found in Italy. So it turns out that 38% of people that are hospitalized in the United States are under 55 years old. And 20% of people that are hospitalized in the United States are between 20 and 40 years old. So I think that as younger people felt more immune from this and felt like this virus wasn't going to affect them, that we're finding that's actually quite different than it appeared to be at first. So it's really important for younger people also to pay attention to the same social distancing and hand hygiene and keep your hands away from your face instructions. The second thing is that it's becoming more clear that men seem to be affected in a more severe way than women. And in Italy, at every age group, about twice as many men died as women. And it's not quite so bad in some other countries, but there is a predilection of men dying faster. And it's not clear whether that has anything to do with the specificity of how the virus infects. But what is clear is that when we look at health activities, including smoking and drinking and obesity, there tends to be a predilection for men, at least in some of those categories. And so the speculation is that having poor health is really the thing that drives men having higher mortalities, more severe disease, more hospitalizations than women. And I would say for people in the state, it's really a good opportunity to try to get generally healthier, stop smoking, start exercising more, because we know that exercise and fitness is important in this situation. The last thing I'll say is it's becoming more apparent how this virus works, and I think that's really very powerful to know. So the virus lives when it gets on surfaces in a hibernating state. So it's not really alive at that point. And it's waiting to get access to your nose or your mouth. And when it gets into and you breathe it in, if somebody coughs with droplets, or you pick it up from a counter or a doorknob and put your hands to your face or your nose, the virus immediately gets in your body and infects the cells in your upper airway. And by 24 hours, there's 10,000 copies of the virus in each cell. And by 2 or 3 days, there's 100 million copies of the virus in each teaspoonful of blood. So this virus multiplies very quickly. And from the data in China, we know that the virus is often highest in concentration early in its infectivity in people. And therefore, people can infect other people without ever knowing that they're infectious. And in fact, about 80% of people, at least in one survey in China, had either no symptoms or minimal symptoms. And there's an article in the New England Journal of Medicine that demonstrated that the highest viral titers in swabs from the upper airway nasopharynx were in day 1 and day 3. So I think it's really important also that people not kind of get convinced that they can't be infected by somebody because somebody didn't have a cough or a fever. And in fact, that's one of the secrets, I think, for this virus transmission. So with that, I will turn it over back to the panel.
Thank you, Dr. Marsh. Up next, we have Secretary Bill Crouch with the West Virginia DHHR.
Thank you. Clay mentioned that we had essentially a doubling of the numbers yesterday overnight from 20 to 39. We know we're going to see more cases. The more testing we do, the more cases we're going to see. We are going to try to focus on our healthcare workers out there here in the next week or so. We understand that they're doing a difficult job at a difficult time. We have physicians, we have nurses, certified nursing assistants, x-ray technicians, and a variety of other folks who are working hard to make people safe and to get people well. So we recognize the need for personal protection out there, for additional masks, for additional gowns, gloves, and we are literally scouring the world for those. General Hoyer's team has jumped on this, and we're looking very hard everywhere we can to try to purchase more and to bring more in. We do have shipments coming in of PPE, and we're getting those out as quickly as we can to facilities. We need more, and we're going to do our best to find more and get those shipped in quickly. So, again, our healthcare workers, I just want to thank you. It's a tough situation right now. I appreciate what you're doing from my standpoint. One other thing is just as Clay's already mentioned, citizens, our our elderly need help, they need protection, they need to stay isolated, they may need food, they may need prescriptions. So take care of your family, take care of the elderly. If you know someone who needs help, go to our website. There will be a way to find somebody there. There's a 800 number there. If nothing else, that can get folks routed to us. We'll provide any assistance we can to folks out there who need it. Thank you.
Thank you, Secretary. Up next, we have Dr. Kathy Slimp.
Thank you. A couple of key messages, I guess I would say today. One is just reiterating the importance. You've heard of all the activities that are important to do that Dr. Marsh and that Secretary Crouch have mentioned, and the governor as well, so articulately. But I think the one that I would add right now is this is a really critical time to stay home if you are sick. And so you really to think about the fact that if you have any symptoms of disease, please do stay home. Do not go, even if you're an essential worker, to work, because you want to make sure you protect your rest of your coworkers, and you want to make sure that you protect the family around you and the community. So please do stay home if you're sick. We actually typically say at least a week. If you're having a fever, at least 3 days beyond the fever. If it's longer than a week. So that's an important piece, is to stay home if you are sick. And if you're not, and you are an essential employee and you need to get to the office, you want to make sure that you do that as well as safely as you can. An employer should be working with their employees to really allow that to happen. The second thing, I'm always just encouraged by how I see people supporting each other and delivering services in creative ways. So with a day of prayer, I heard about a church that is doing low-frequency broadcasts from the church, and everybody comes to the church in their car and listens to the service. There's other ones that people are just doing really creative other ways to support and connect with each other. So that's really important, and I think that's just a critical issue for the current time. The third one, the last one I would speak to is, especially in times of change like this, and you start to see a lot of things unfolding, it is naturally very anxiety-provoking, and it's stressful for everyone. And so as much as we can recognize that is normal, that we have ways to address that, that we can really do several things. One, we can get good information and communicate with each other. So whether that's the website or whether that is, we had a call with 5,000 folks from the AARP this morning. Getting information and getting your questions answered is really helpful. Also, I find taking a break sometimes. There are times when I have to turn the radio off because I need to hear about something other than coronavirus, or to step out of social media for a little bit. Not that I've seen that much recently because I've been a little busy, but I think taking a break from things is helpful, and then before you come back into it, and then just enjoying those moments. I have to say the parts of my day that make me kind of rejuvenate is when I walk out in the morning and I hear the birds singing, and there's a moment that I can just say the world is normal, and there's that natural beauty of nature that can be very peaceful. And similarly, walking over today, the moment that hit me was seeing a parent and a child on the Capitol lawn kicking a ball back and forth. Those normal things that we can still do and want to do, that we need to make sure that we allow those to continue and to sustain all of us through this time. So thank you.
Thank you, Dr. Slimp. Up next, we have Major General Hoyer with the West Virginia National Guard.
Good afternoon. West Virginia National Guard continues to focus on the 4 lines of effort directed by the governor. Operationalize support to agencies to allow them to operationalize their capability, stabilize the population, logistics support, and information and data analytics. I'll highlight a couple of key areas of those items. Today in particular, support to Kanawha County Health Department, as well as support to the Monongalia County Health Department related to the specific increases that we're seeing in those 2 areas, to provide support and linkage with the State Epidemiology Office to address the contact tracing and other activities that need to be taken into account. Related to the logistics piece, yesterday 53,000 N95 masks, 50,000 surgical masks, 46,000 face shields, 21,000 gowns, 18,000 coveralls, and 2,800 pairs of gloves were distributed. I would like to explain just a little bit, as Secretary Crouch talked, we're starting to develop the numbers that we think that we may need over time. I think it's important for folks to understand, with the national shortage and the worldwide shortage, what we're having to do is to develop different sources of suppliers, and then from that be able to build what we need to receive in a daily burn rate. So this is a much more complex logistics operation than might normally take place. We can't place an order for 2 million masks and then expect that they're going to come in at the same time. So we've got to do multiple sources, multiple supplies to be able to do that. So I hope from our healthcare personnel to others, they understand that we are working diligently to build that supply chain necessary to help support them, and we understand the significance of what this logistics piece means to everyone in that area. From a stabilization population, food banks that we were told may have been out of food yesterday has been validated by VOAD that they do have support that they need. The child nutrition program with the State Department and the county boards of education still continues to go well and is working for our students, and we'll continue to work to improve that. A couple of unique things that are occurring I think are important. The food bank, VOAD, National Guard working together are beginning to build supply system in that area. For example, 624 30-day food packs were prepared yesterday for seniors. So that cuts down on the movement of time. It allows seniors some stability as well as for families going forward. So some innovative things being done to help address that. I think it's important to also note that a couple of our food banks have already seen a 30% increase in the request for support going forward. So those are things we'll have to work in our supply chain as well. In addition to the other logistics support that went out, 30 of the systems, you'll hear me refer to them as PAPRs, P-A-P-R. Those are the self-contained systems that allow us to reduce the volume of other masks and things to be used. We'll go to, thanks to the support from the State Fire Marshal's office, we'll go to WVU Hospital today to address that particular pocket of what we have to deal with in the Monongalia County area. The last thing I would leave you with is something, again, innovative. Our CTE system within Department of Education and our community and technical colleges have prepared some sample masks that they're making with 3D printers. In addition to that, the National Guard owns a parachute shop that supplies parachutes for most of the East Coast of the United States military airborne force. We're using those assets to develop some prototype masks. Those are being analyzed over the next day or so. If they are determined to be effective, then we'll go into production with those, which will give us one more source of support for that PPE going forward. So a lot of things going forward today, and a lot of movement in a number of areas. Thank you.
Thank you, General Hoyer. Once again, we are holding today's briefing with media members joining us virtually to practice good social distancing. To ensure all outlets have an opportunity to ask questions, each outlet will be given the floor to ask one question on our first run-through. The order has been selected at random. Depending on time, follow-up questions may be permitted. Again, today's panel members are Dr. Clay Marsh with WVU, Secretary Bill Crouch from West Virginia DHHR, Dr. Kathy Slimp, State Health Officer, and Major General Hoyer with the National Guard. To media members, when we call on you, please remember to unmute the microphone on your end before asking your question. Please confirm your name and affiliation. Today, some media members will be asking their questions through video chat. Today's first questioner is Glennis Board with West Virginia Public Broadcasting.
Hey, can you hear me?
We can.
Great, thanks for this opportunity. I've got a couple of different questions, but I'll stick with this question about childcare. There's some conflicting reports about essential services, and I'm wondering if you can address that. If you're in business, despite essential requirement things, that's something that anybody on the panel can
hearing.
I couldn't hear the question. I couldn't understand the question.
So the question is about
Child
child care.
As an essential service.
This continues to be an issue that we think is really critical, and I know our Bureau of Children and Families, who works with child care centers around the state, is actively working with folks, including sustaining the child care that they currently they're operationalizing, making sure they have the right guidance, et cetera. In addition, they are working and helping kind of the short-term pop-up, they're kind of called, or pandemic child care opportunities. And so there's guidance that they are working with folks on to advance that area as well. This is a critical area. I know we have the same issues within our own staff who are teleworking at home with children and trying to manage a pandemic.
One of the things, sorry I couldn't hear that question, but one of the things we are doing, which is extremely important for our folks out there who are in the healthcare field and who are working in hospitals, is to try to develop these child care services for our healthcare workers. So we're looking at every option we can out there to provide assistance to our workers.
Okay, thank you, Glennis. Up next, Charles Young with WV News.
Hi, this is Charles Young with WV News. My question was for General Hoyer. Could you tell us what the extension of the school closure means for the ability to feed the children and continue to provide meals for both the weekdays and the weekend?
Yes, so obviously, clearly that creates just additional logistical requirements. We're already have a team of folks from Department of Education working with the National Guard, VOAD, the food bank to address that. Charles, I think one of the things important to understand that they're looking at in this coordinated effort is an effort to continue to provide the child nutrition meals during the week, and then with the food bank and the other support through VOAD to be able to provide the weekend support for the family. The food packs are also now being put together based on families versus just the children. And then, as I mentioned, those 30-day food packs are also being looked at as another way to address what you just described as an issue going forward.
Okay, thank you, Charles. Up next, Amanda Barron with WSAZ.
Hi everyone, Amanda from Channel 3. What measures are being taken to provide financial relief to struggling healthcare providers? Many of them are operating in slim margins with really vulnerable populations in very rural areas, also dealing with a lot of IDD and mental health issues. And how successful is the telehealth right now and telephonic help? We're getting some information that it's not enough for some providers right now, but I do wonder about those rural hospitals and how often you're in contact with them right now as we continue to see more cases grow and their vulnerabilities, how you're safeguarding them.
Related to telehealth, there's a lot happening with that. The 1135 waiver has been submitted. We've actually collecting some additional new information on some things. I know in the Bureau and DHHR, we are working to initiate a webinar series for our healthcare provider system. One of the first topics we'd like to cover on that is telehealth, because there's actually probably more capacity to do it than folks realize under the current situation. And we need to make sure it's practical for people. So we are looking to, we've got people gathering that information that we can disseminate it as soon as we possibly can with our providers and to have some dialogue and discussion around that issue. There's, what was the other part? Healthcare worker supports. Dr. Marsh, do you want to talk about healthcare worker supports and financial? Some of that's national and other places as well.
And I think that I think that's a really important question. And, you know, from a provider standpoint, you know, one of the challenges in West Virginia that we all know is that we have a high-speed internet bandwidth issue. So as I understand it, you know, perhaps as many as 40–45% of our citizens don't really have the internet connectivity that they need. And that obviously affects, you know, telemedicine delivery across the state. And, we do support telemedicine and also with tele-ECHO, which stands for Extending Community Health Outcomes, where more specialty people help train more primary care people. But everything's been really disrupted as we've started to try to tell people to stay at home, and we're rapidly at WVU Medicine trying to convert over to more televisits. So I think it's a real challenge right now for a lot of the providers. When it comes to supporting providers in rural communities, I think Secretary Crouch might have a set of thoughts on this too. But we are trying our best to make sure that we continue to support people that are out there, doing work in the rural communities. And ultimately, these are vulnerable populations, taking care of vulnerable populations, because to be a rural health provider is something that we really need more at the state level. And I think that is certainly an area that we should be able to help with, given the stimulus packages. It looks like it may be as much as $2 trillion. So I think this is a population of people that we would really benefit supporting as part of this bill. But Bill, I don't know if you have any thoughts about that.
It's crucial. If we don't support our healthcare workers, we're going to fail. We've got to have our healthcare workers in the facilities, especially our rural health facilities. We have a great number of providers out there who are struggling right now from standpoint of payment for services. We have a period right now where utilization is actually low in many hospitals because surgeries elective surgeries have been postponed, and you have hospitals with empty beds, revenue not coming in. We need to keep our workers paid. We need to keep our workers ready for additional patients. We are going to get a surge of some sort. We're hoping that's low, but we need to do everything we can to help our workers. I approved this morning mentioning child care for our workers, some exemptions from some of the requirements there, so we can get folks out there quickly and up and ready to help in other ways. So we're trying to do everything we can there.
Okay, thank you. Up next, we have Phil Kabler with the Charleston Gazette-Mail. Phil, you may need to unmute.
There we go. Yeah, maybe that'll work better.
We got you. Yep.
Can you hear me? I've had a couple of requests for a more detailed dashboard at the DHHR. People pointed out other states have much better coronavirus dashboards, much more detail, county by county. And has there been any thoughts? I know that everyone's plate is full at this point, but any thoughts to upgrading the dashboard as it currently exists?
Yes, we are working on that. We've got quite a few different folks helping us put something together. I will tell you, while we're putting that together, and I would hope to have that by the first of the week or so, but not sure of a definite date yet. But beginning Friday, we're going to have a little bit more information available in terms of our positive cases. We're going to try to have that available from around the state in terms of those counties that are posting those positives. So we will compile those, try to have those available and updated 3 times a day. The official report that DHHR does, that Kathy's shop does, are those cases that are confirmed. Clearly, counties have the right, county health departments have the right to publish those and announce those positives. So there's a little lag in terms of what comes from the counties and what comes to the state in terms of the Public Health Bureau. Kathy can talk about that a little bit more, but we're going to try to provide more information, including a change to a dashboard that's a little more useful for you.
I can speak a bit to the numbers. And we collect information on cases of infectious disease and other diseases every day. we just are not living them in the media all the time. So what happens is this, like other diseases, is reportable from the facility or the laboratory diagnosing the disease to the local health department. The local health department gathers information. It then submits it to the state. So we have a good, solid database of information about what we're seeing that we can then use for prevention and other efforts. And then we purport, aggregate that data to the federal government so that they can track what's happening in terms of cases around the country. So that's where you're hearing the numbers coming in on the national media. So with these systems, there's always a little bit of a lag time. So it's a day or two before it will catch up at the next level. And you'll see the same when you go to the federal numbers at CDC. It will say if that numbers at the state may be a little bit higher, a little different than the federal numbers. And it's just a natural part of the reporting system. We want to make sure as a nation that we have good, solid data. And so that data takes time when you're doing this many cases happening this fast. The important point is that people have that information at the local level where they need to do that response immediately. And then we support them in doing that, and at the same time we collect that information so that we can look at what's happening across the state, understand how it's spreading out across the state, and how the demographics of our information occur, and then we pass that information on so we can learn more as a nation with that. The dashboard, we are definitely looking at, now that we have more cases, we're looking at how we can display it by county more in a different way, and I think that just will evolve as we now have information.
Thanks, Phil. Up next, Aaron Beck, the Register Herald.
Aaron Beck, Register Herald. Can you hear me?
Yes, we have you.
Okay. So, you all were talking about how you were desperately seeking personal protective gear, like things like masks and gowns and gloves earlier. I'm wondering about the current situation. I know that you're anticipating an influx of patients, but I also would like to know about the current situation at West Virginia hospitals. Are there, and I'm particularly interested in 3 groups of people. That would be people showing symptoms of COVID that have not been tested, people that showed symptoms of COVID and have been tested, and people that have been diagnosed with COVID. So three categories there. Are there healthcare workers in West Virginia and West Virginia hospitals that are happy to work around any of those 3 groups without protective gear? And I would like a yes or no for all 3.
Let me speak to that a little broadly. We clearly know that we aren't going to have the testing that we would like to have ideally, and that's here and nationally. So we will need to manage this situation without that. Now, that's also true in other diseases that we have as well. So flu, we do not test every case of flu. You manage those clinically. So not everyone needs to be tested for coronavirus. If you have mild disease and you are at home, if you have mild disease and you are doing well, you stay at home and you take care of yourself there. You actually don't want to introduce that into a healthcare system or to put others at risk with that. If you need more care, you go to the hospital or to your doctor's office. You call your doctor's office and you work with that. And then if you need to be hospitalized, you are hospitalized. So the question of testing is that we are actually trying to prioritize things such as healthcare workers that have symptoms so that we can make sure that we support them in managing their disease, and so we support them in being able to get healthy again and come back to the healthcare system appropriately. So it's critical, though, so that's one priority group. There's many other priority groups for the testing. PPE is critical. There is not adequate supplies currently. We hear that from lots of folks. They're running low. But this is what we actually are starting to have a flow. So we're doing everything we can. We've sent that 50,000 masks and several other things out yesterday. It's going to come in chunks as we get more and more in. Folks are doing a great job conserving what they have and working together. And so I think this is a challenge. And we have got to get more there. And so I think this is a clear mission that we hear loudly from folks, We passionately believe it as well, and we need to together work to make it happen.
This is Clay. I just want to chime in just for a second. So I think that every healthcare system has very clear guidelines about healthcare workers who are sick. So if you're sick, you go home. And if you are sick and you go home, and the concern is that you have the symptoms of the coronavirus, then in general we will try to test you because we are worried about you, of course, but we're also worried about the people you may come into contact with. So people that are sick should not be working without personal protective equipment. They shouldn't be working. We have clear guidelines from CDC and from the DHHR, including Dr. Slim, where we basically know about how long we quarantine people and who we test and who we don't. We certainly want to test healthcare workers who are ill because we want to make sure that if they do come back to work, that they're able to do that they don't, have any, aren't the source of infection for other people. So as far as I know, healthcare workers that are sick are not working. People that are sick in higher risk situation settings, we will try to get tested, and we are trying to get more personal protective equipment, but we certainly have sufficient personal protective equipment today to be able to navigate those kind of interactions. And I think Dr. Slimpton is exactly right. If we look at national issues, I have a friend who's the dean of the School of Medicine at Cornell, who's a lung and ICU guy. That's what I did at Ohio State. And so he emailed me and he said, can you send me critical care physicians? Because we have 100 people with coronavirus in our hospital and 100 are on or 50 are on ventilators. And we need more critical care people. And we don't have enough personal protective equipment for very long. So this is an issue everywhere, but with General Hoyer, as we talked about with our acquisition, the hospitals also have supplies of personal protective equipment. So at this point, we're still okay, but that's the reason why we're so focused on trying to avoid the surge.
Okay, thank you. Up next, we have Anthony Izaguirre with the Associated Press.
Hi, yes, it's Anthony with the AP. Is there any update on suspending the CON process for hospitals? And can you walk us through plans you have if the virus starts spreading in areas that don't have hospitals?
I'm sorry, can you repeat that last part?
Can you walk us through plans you guys have if the virus starts spreading in areas without hospitals?
Well, we're going to see cases everywhere. Those cases that are from areas that don't have hospitals will come through the local health department. If individuals need hospitalized, they'll go to the hospital that is probably closest to them that can meet their needs. The CON process is not an issue unless we were to try to provide healthcare services that would normally require a certificate of need, but that are specifically for the pandemic. In that case, the governor's order would allow us to do to bypass that process, but only as it relates to the pandemic and how we care for patients.
Okay, thank you. Up next, Kenny Bass with WCHS.
Hi, this is Kenny Bass with WCHS-TV. Quick question and clarification from Dr. Slimp, if possible. It has been rightly said that West Virginians are great at banding together when there's a need. And so many West Virginians are now making these protective masks either in their churches or their homes, and they're sewing them together. And yesterday you said those masks would probably be best used for maybe making a trip to Walmart, or maybe if you're out and about, not for first-line healthcare providers. Speaking with an epidemiologist today, she told us that CAMC is using these homemade masks with their frontline personnel, just not those dealing directly with the COVID-19 virus, but say your you're a general nurse and you're working with an orthopedic patient or somebody who's got an upset stomach, or et cetera. So can you clarify, these people probably really, they want to know if their efforts are going to go toward protecting healthcare providers, even if it may not be the ones who are dealing directly with the coronavirus.
Sure. Everything that we each do helps protect the healthcare workforce, because if we reduce spread. I love the fact, and it's wonderful that folks are really creatively developing these masks and using them. So I think you're exactly right in terms of they're great through community-based risk settings. It might be really good for some of our, for many of our essential workers that are out working. That helps protect them in a way so they don't touch their hands to their mouth, et cetera, or if they are coughing and sneezing, they don't project those things. They're great for that setting, and there probably are positions in healthcare systems where that's absolutely a fine thing to use. But it's not the first choice, of course, when you are having that higher risk contact with ill patients. So it's just a what you are doing, what's your risk.
And if I could just add, this is Clay. If you look at Atul Gawande's article in the New Yorker that was recently published, and Gawande is the guy that Jamie Dimon and Warren Buffett and Jeff Bezos picked to be the representative person for the three companies that they own. He studied the experience in Wuhan, China, and what he found was for most people, wearing surgical masks, which don't really obstruct the spread of the virus, that is not what's the word I'm looking for? The obstruction ability, that's not the right word, the blocking ability of those masks is not sufficient to block the virus. But it is, as Dr. Slimp said, it's good to remind people not to put your hands to your face and to wash your hands. So it's really interesting that given, the great need for protective equipment and that many people are innovating. And I think that as we go forward, we'll need to test some of these masks to make sure that they do offer sufficient protection. But as Dr. Slimp said, it's really terrific that people are very much committed to working with the healthcare workers in West Virginia. And General Hoyer has a team that may have materials that could be put together that may work like a obstructive N95 mask, the ones that you want to wear if you do have aerosolization of the secretions in somebody with COVID. So I think we're learning a lot, and we're looking at alternatives all the time.
Okay, thank you. Up next, Stephen Allen Adams with Ogden.
Yes, Stephen Allen Adams with Ogden Newspapers. President Trump and Governor Jim Justice have both now talked about this anti-malarial drug, chloroquine or hydroxychloroquine. And I know the University of Minnesota is doing their clinical trial on it right now, but I was wanting to hear from the health experts about whether it was too soon to be talking about this as a possible obviously not a cure, but a treatment of sorts for some of the symptoms of COVID. Is it too soon to be kind of touting that or talking about that? What is your thoughts on that? Thank you.
Yeah, I think it's.
This is Clay. I'm sorry.
You go ahead.
Thanks. This is an interesting drug. So the way that hydroxychloroquine works, it's a malaria drug. My understanding is it aids the killing of cells that ingest, inside the cell, foreign infecting agents, and malaria is one, and that's a way that the novel coronavirus goes as well. So the idea would be that if the cell engulfs it and surrounds it, it may add to the killing ability for this novel coronavirus. In a small study in France, the combination, either the hydroxychloroquine alone or in combination with a medicine that we often take for colds, azithromycin, Z-Pak, seemed to have an impact in helping people and perhaps reducing some of the viral replication, although that was less clear in the study. It was very, very small. But I think that the CDC gives guidance and that there's really two treatments that you could try, but they're not approved. One is an antiviral agent called like remdesivir or something like that was made for RNA viruses, which the novel COVID virus is. And that is right now only available for clinical trials and can be asked. They're looking at potentially giving it for compassionate release. And the hydroxychloroquine plus or minus azithromycin. So I think most people, including my friends in the critical care community, if somebody got sick enough to go to the ICU, they would use hydroxychloroquine, and they would use azithromycin with it if they had that available, but hydroxychloroquine they would use. Whether or not that works, there are clinical trials that are ongoing to give us more stronger data in a way that you compare it to nothing so that you actually see if there's a real impact. But people are using it frequently. What's notable and important is some people are trying to sequester hydroxychloroquine to take preventatively or to use themselves. And a few people have died of using this as a prevention or a prophylaxis in the community. So it's clear that you don't want to use it if you're healthy. If you're really sick, then I think that is a drug in our tool belt that we can use and try, but there's no direct evidence to say it works other than a very small 26-person study in France. So, Kathy, I'll throw it back to you.
Okay, thank you. Up next, David Beard with the Dominion Post.
Hi, this is a question for DHHR. My editors received a correspondence from someone who says they are a DHHR social service worker, and because of the PPE shortage, they're being required to go into homes without any masks or such. We were wondering if that's correct, and should they be concerned if they are doing that?
I'm not aware of that, if anyone else is.
We actually sent them some yesterday. That's part of the distribution that we've made. Just like other folks that are essential workers in communities, I think that's like the masks we've just spoken about. Those could be really helpful.
Thank you.
Thank you. Up next, Taylor Stuck with the Herald-Dispatch.
Hi, it's Taylor with the Herald-Dispatch. Dr. Slump, yesterday you talked a lot about what to do if you have symptoms and making sure that you stay home and call your doctor. I was wondering, though, what happens if you don't have a doctor or if you don't have insurance? What is your recommendation for those folks if they think that they are exhibiting symptoms or may have been exposed?
Yeah, there are folks that don't have physicians in our state, absolutely, and I think that's really critical that people have access to care. We've done a lot of work in that over those last several years as we expanded Medicaid, but it hasn't captured everyone. So we do have a strong system of federally qualified health centers, FQHCs, that do serve uninsured and others. So I think working with and through them to identify a care system if you need someone. Local health departments can sometimes refer you to a location in their community. It's important that we have that access.
Okay, thank you. Up next, Brad McElhenney with West Virginia Metro News.
Hello, everyone. Thank you again. We now obviously have the community spread that we anticipated. Early on in these press conferences, there was talk about the precautions for West Virginia's correction system. So what I wondered is, now that we've reached a new phase of community spread, if additional precautions are being taken for the correction system.
One of the first meetings that we had with this was actually with our Department of Military Affairs and Public Safety and Commissioner Jividen. And so I know they are doing proactive work to prevent spread in these facilities. Anytime you've got congregate settings, it's a high risk. And so she could speak more to the specifics of what they are doing, but it is a critical area. And I want to do one correction to the uninsured question too. My understanding, and I may need to get Secretary Couch to verify this here, but my understanding is part of the 1135 waiver actually helps Medicaid coverage be provided to uninsured for COVID, is my recollection. I will double check that.
Okay, thank you. Up next, Haley Kosick with WOWK.
You guys got me?
We do.
Okay. So this question actually comes from our sister station, WTRF. They have a small community called Sistersville, and today they had their municipal election today, and they canceled it as a precaution, but then apparently was reprimanded by the Secretary of State's office for canceling an election, saying they can't do that. I don't know who could speak on this since the governor is not here, but if anybody can take a stab at it, I'd appreciate it.
I don't believe we do have anyone here to respond to that. Sorry.
Other than that, I'm good.
Okay, thank you, Haley. We have one follow-up from Glennis Board at West Virginia Public Broadcasting. Glennis?
Hey, thank you again. Just curious about the 39 positive tests. How many of those had severe symptoms and had to be hospitalized? And we're wondering if they had pre-existing conditions.
I don't have the breakdown on top of my head. The bulk, especially of our initial cases, were all outpatient. So I think the bulk have been outpatient, and many of these are getting found as we are doing contact investigation and tracing. So some of those are outpatient, some of those end up being inpatient. So I don't have that breakdown, but we can look at that more fully.
Thank you.
Okay, thank you. Another follow-up from Kenny Bass with WCHS. We may have lost Kenny. I see.
Sorry, I was trying to unmute my microphone.
Okay, we got you.
Sorry about that. It was about the website and you've already covered some of what I was curious about, but is there no way to take when these counties make these announcements to put maybe more people on the website itself to make these updates? Because while I fully understand the hurdles and the problems that you're facing, and they are certainly reasonable, it is causing great confusion when the numbers don't match up, because people, whether rightly or wrongly, they're paying very close attention to the numbers. And when they look at their county, like a Kanawha County, which has this big increase, not reflected on the state website, it causes them great concern.
Let me mention again what I talked about earlier in terms of an unofficial report that we're going to try to update 3 times a day. That will hopefully begin Friday. We're going to try to provide unofficial numbers in terms of what we know from actually public information in each county. And then our official update will come again late in the day with those cases that are confirmed. So we are looking at a better way to report. We're trying to be transparent and trying to provide accurate information to you. The numbers will never match because counties come out with tests. Now that hospitals are doing their own testing, we have commercial labs that are providing testing. They're coming from a number of different labs now. They will never come in at the same time, and the counties will never report those at the same time. So we're going to try to help you with that in terms of an unofficial report every day, but keep in mind the official report from DHHR, from the Bureau of Public Health, will be once a day, and that will be on our website.
Okay, thank you. We'd like to thank all the members of the media for joining us and our panel members for taking time out of their busy days to participate. If we didn't have time to answer one of your questions, you can feel free to submit it in writing. There are a few in the chat that I think we don't have an expert here to answer, but we'll try to get those answered today. And with that, today's media briefing has concluded. Thank you.